Yeah, I think it is streaming. Hi, a very good evening. So happy Sunday, all of you. So we're starting this session a couple of hours prior because of some other work which I'm occupied with. I have again two options of either conducting this session early or conducting this session late or canceling it altogether. Also, I have a third option, but I chose the first option. It's better than having a late session. In fact, it's always better late than never, as they say. So I hope you guys are all ready, and excuse me, and I apologize for this inconvenience. So I hope you guys are all ready. So today's quick revision class will focus on few select topics from microbiology. So we'll start with yesterday's case-based question, and then we'll proceed with some select topics. I hope you guys are all ready, and please confirm the audio and video streaming. I think it's all streaming good, as usual. Okay, so this lively or lovely shirt, this is a theme for weekends from now on. Every Saturday and Sunday, if at all we plan a session, we'll have this themed shirts, and also we'll plan June live sessions where I'll make sure that we are doing with a dress code, right? It'll be much more fun. Anyways, I hope you guys are all ready. So first, I'll be taking you somewhere, and from there we'll jump into academics. So that somewhere is Madikeri, which I visited a couple of years ago, a lovely place. It's a hill station, which is around 24 kilometers from Coorg and around 130 plus kilometers, I don't exactly remember, from Mangalore. So one of the lovely places and one of my favorite places. And you can definitely plan vacation. So this is all, I'm trying to give you heads up and inputs regarding where you can plan vacation. I hope these live sessions also help you in that direction, right? Okay, so you can see it's all about enjoying each and every moment, no matter where you are. You can be on vacation, you can be at home, you can be preparing. What really matters is enjoying what we're doing. Sometimes it's very normal to feel stressed, very normal to feel low. There can be fluctuations or alterations in our mood. It all depends on various factors, as you might have been experiencing for the past several months or years. So during those challenging times, all we need to do is just hold on, take a break, and then all we need to do is just hold on. That's it. That itself will provide solutions to all the existing challenges, because most of the challenges which we deal with are psychological in nature, isn't it? So today's live session will focus on microbiology. Before that, we'll deal with this case-based question from yesterday's live quick revision class general path. So what do you think is the most appropriate answer? What's the diagnosis? A 30-year-old woman had a firm nodule palpable on dome of uterus 4 years ago, recorded on a routine physical examination. So the nodule has slowly increased in size and is now appearing to be about twice the size since it was discovered. And she remains asymptomatic. So which of the following neoplasms is she most likely to have? Adenocarcinoma, rhabdomyoma, rhabdomyosarcoma, leiomyoma. So you seem to be having these tumors from a smooth muscle origin as well as skeletal muscle origin. So we're talking about the anatomical location uterus. So that itself is one hint. And we're talking about the pace of growth. That's the second hint as we discussed prior. So which one do you think is more appropriate answer? Yes, please keep answering this. In the meantime, let me review some information. And as I said, if you're wrong, you have nothing to worry about as long as you're learning from each MCQ. So leiomyomas, usually most commonly located on a uterus. The leiomyoma, also called as fibroid, is a benign tumor derived from smooth muscle. It may occur anywhere in the body, but is most frequently seen in uterus. Consider this very, very important. Other areas include stomach, esophagus, small intestine, smooth muscles. It is the most common tumor of women. All neoplasms of muscles, if you're going with neoplasms of muscles, for your information, neoplasms of muscles are rare, but when encountered, they are usually malignant. Look at the description of this case. So rhabdomyosarcoma, as you guys are aware of, it's a malignant neoplasm derived from skeletal muscle, so you can rule it out. So if you look into various inputs provided in this particular case, and based on anatomic location, based on the rate of growth, it is option D. So I'm glad some of you have chosen option D. As I said, if you have done wrong in this, you have nothing to worry about. It's time to fact check, make a note, and then move on. That's it, right? So well done, everyone. So we can see the characteristic world appearance. So this is what I wanted to highlight in this specific slide. So you can see extreme left diagrammatic appearance of common locations and characteristic world appearance on cut section. So whirling is evident, right? Left side and also in the central image. And also you can see various locations in the uterus, subserosal, submucosal, and intramural. So consider this feature very, very important as well. And as I said, leiomyomas, they're also called as fibroids. Consider this important. Now we'll dive into the topic proper. So microbiology, 18th quick revision class. First question. So gas gangrene develops in traumatic wounds contaminated with foreign material containing which are the following microorganisms: Clostridium perfringens, Fusobacterium, Veillonella, and Corynebacteria diphtheria. So the moment we come across the subject microbiology, it's almost always jitters for most of the aspirants. But as I said, you do it properly, proper revision, notes preparation, and of course, repeated revisions. It will lighten your burden for sure. So let's see how you do in this particular live session. So first question, so what do you think about gas gangrene and which microorganism is implicated? I think this is one of the standard or stock questions, and I'm sure most of you will answer it right. So let's review some information regarding the same. Top left you can see, yes, as you rightly said, Clostridium perfringens. So Clostridium perfringens, this image is from CDC website. So gas gangrene, as such, develops in traumatic wounds, as you can see in the bottom right illustration, with muscle damage when they are contaminated with dirt, clothing, or foreign materials containing the microorganism Clostridium perfringens or other species of histotoxic Clostridium. This Clostridium perfringens is also implicated in food poisoning, given that's considered to be very, very important, especially in developed countries. So Clostridium perfringens cause food poisoning if large numbers of enterotoxin-producing strains are ingested. Outbreaks usually involve meat dishes such as stews, soups, or gravies. Gravies are a favorite. So this is implicated because of the alpha toxin which is released by the microorganism, and also because of the oxygen-deprived state which has been implicated in this pathogenesis, gas gangrene. Okay, so as most of you have rightly chosen, option A is the right answer. Hi everyone, a very good evening. So let's move on to the next question. Well done everyone. Let's move on to the next question. So which of the following species causes shigellosis associated with significant mortality? So there was a question along these lines, not exactly the same, the recently concluded INSA. So let's see how it goes. So Shigella flexneri, Sony dysentery type 1, Salmonella. So which one do you think is more appropriate answer? Mostly associated with mortality, in your opinion. So this is dark field microscopy of the microorganism, which is the answer for this particular question. So before I reveal what this is, let me review some information. Yeah, I think Sonali loves Sony because it's rhyming. Is that the reason, Sonali? Okay, shigellosis, there are several manifestations. Shigella organisms can cause acute inflammatory colitis and bloody diarrhea, which is the most characteristic state, presenting as a dysentery syndrome, where there is clinical triad consisting of cramps, painful straining of passing tools. When you pass tools, there will be painful straining, which is called as tenesmus, and a frequent small volume bloody mucoid discharge. Characteristic clinical triad. The disease usually begins with fever, and systemic manifestations are weakness, anorexia, and sometimes myalgia or muscle pain. Also, there will be watery diarrhea containing large number of leukocytes detectable by light microscopy. and the diarrhea may turn bloody with or without other classical signs of dysentery. And the manifestations are more severe with Shigella flexneri, the species that predominates in the developing world, and the most severe with Shigella dysentery type 1, that is Shiga bacillus. So all the vast majority of shigellosis cases resolve spontaneously within 1 week, that is 2 to 5 days. The mortality in Shiga, that is Shigella dysentery type 1, especially in epidemics in Asia, Latin America, and Africa, developing countries, has been as high as 20%. 20%. So you can see this particular illustration, dark field microscopy, representing Shigella dysentery bacterium. And for your information, Shigella, they are gram-negative, non-motile, facultative anaerobic, and non-spore-forming rods, right? So, B or not sure? Okay, right. I think none of you have chosen option C. I think this is the first time none of you have chosen the right answer. So, again, kudos to your teamwork. Okay, don't worry. So option C, Shigella dysentery type 1 is a right answer. Sony has selected option C. Good, Sony. Right. Now let's move on to the next question. So this is very interesting. I think some of your favorite food, fried egg. So inverted fried egg appearance is seen in which of the following colony culture? In is missing, I'm sorry. Ureaplasma, Mycoplasma pneumonia, Haemophilus influenza, Bordetella. So which one do you think is more appropriate answer? Inverted fried egg, omelette, not the one which is mixed or mashed together. Just a normal omelette where you find yellow and then a peripheral white, right? So when you invert that, so inverted fried egg appearance is a characteristic appearance which is seen in which of the following culture. Good, you're right. So let's review some information regarding this. In the meantime, others can answer. So these specific microorganisms are about 0.2 to 0.3 mm. So Mycoplasma pneumoniae, as almost all of you rightly mentioned, is the right answer, is an aerobe, but most other species are facultative anaerobes. All grow slowly in enriched liquid culture medium and on special Mycoplasma agar to produce minute colonies only after several days of incubation. The center of Mycoplasma pneumonia, as you can see, it appears comparatively opaque. It's because of inward growth of these colonies, Mycoplasma pneumoniae, into the agar, and this central portion appears denser, giving the appearance of an inverted fried egg. And for your information, it's noteworthy. Colonies of Mycobacterium pneumonia bind to red blood cells onto the surface of agar plate cultures. That is, there is heme adsorption. Consider this very, very important. And the reason for this heme adsorption is because of binding of Mycoplasma to sialic acid containing oligosaccharides which are present on the surface of red blood cells. Heme adsorption, an important point which I wanted to highlight, right? So as you all rightly mentioned, option B for ball. Option B is the right answer. Okay, well done. Well done, everyone. Now let's move on to the next question. So you can see clearly omelets. Okay, not exactly omelets. Fried egg, inverted fried egg. Okay. Fourth question, superficial skin infection that develops in a hair follicle or sweat gland, which I'm sure most of us might have experienced, is caused by staphylococcal infection, is called carbuncle, furuncle, impetigo, bruiser. So which one do you think is more appropriate answer? Superficial skin infection that develops in a hair follicle or sweat gland. Let's review some clinical pictures. So you can see extreme left furuncle, central carbuncle, and right impetigo. So let's review some information in the meantime. Yeah, you can try answering this question. So furuncle and carbuncle, I know you're confused. Some of you might be confused. Let's get more clarification regarding the same. Furuncle or boil is a superficial skin infection. Remember, it's superficial than carbuncle. So furuncle is a superficial skin infection that develops in a hair follicle, sebaceous gland, or sweat gland. So that's furuncle. So blockage of gland duct with insufficiency of its contents causes predisposition to infection. Infection at the base of eyelash gives rise to common stye. An infected patient is often a carrier of offending staphylococcus, usually in anterior nares. This is very interesting. The course of infection is usually benign, and infection resolves upon spontaneous drainage or pus. So no intervention, surgically or antibiotic treatment is necessary. Infection can spread from furuncle with the development of one or more abscesses in adjacent subcutaneous tissues, leading to formation of carbuncle, as you can see in the central illustration. So this carbuncle occurs most often on nape or back of neck, may involve other skin sites as well. And carbuncles are serious lesions because there can be bacteremia, invasion of bacteria into the bloodstream, right? So consider this very, very important. And then impetigo, you can see honey crust-like appearance. So let's review some information. So in CDC website, they're clearly given that it's also a bacterial infection, right, caused by Staph aureus or group S streptococcal infection. I'm talking about impetigo. So it appears red as a red itchy source, and then it's covered by crystally yellow or honey crust or honey-colored scab over the source, which heals without scar formation, usually seen or most frequently seen in case of children, right? I hope it's clear. Now, try answering this question again. Superficial skin infection that develops in a hair follicular sweat gland because of blockage, as we have seen, caused by staphylococcal infection is called. Yeah, I'll go with the majority. Option B, furuncle, is the right answer. Well done. Yeah, now let's move on to the next question. So, contemporary based question. Let's see how many of you are going to answer it right. True about SARS-CoV-2. Is it a single-stranded RNA virus? Is it, or does it fall under beta coronavirus? Does it have nucleocapsids which are arranged in helical symmetry? Does it encode for 4 major structural proteins? So what do you think? Yeah. So what do you think is a more appropriate answer? So I'm sure, I'm very confident that we can expect a couple of questions from the current pandemic, COVID-19, SARS-CoV-2, the microbiologic aspect, the pathologic aspect, the treatment part, the pharmacological aspect, the diagnostic part, the medicine aspect. So comprehensively, you can even expect a case-based question, the appearance, radiological appearance of chest x-rays, various antibiotics for treatment of secondary bacterial infections, about vaccines. Definitely we can expect questions from these areas or topics. So what do you think about SARS-CoV-2, like based on the given facts, which one do you think is true? I think you're all smart. By choosing option E, you prove that you're smart. So as you can see, all the options, they definitely are true. And this coronavirus codes for 4 major structural proteins, which are spike glycoprotein S, membrane protein M, envelope glycoprotein E, nucleocapsid protein N, and they have their respective functions. Consider this very, very important. Okay? And in the meantime, let's review some information regarding the same. So coronaviruses possess an unsegmented, single-stranded, positive sense RNA genome. It's not antisense, it is sense or positive sense RNA genome, and SARS-CoV-2 is a member of order Nidovirales, family Coronaviridae, subfamily Orthocoronavirinae, which is subdivided into 4 genera or 4 genus: alpha, beta, gamma, and delta coronavirus, of which this SARS-CoV-2 belongs to beta corona genus. So the genera alpha coronavirus and beta originate from bats. You know, Wuhan, China, you know the story. While gamma and delta coronavirus have evolved from bird and swine gene pools. And these viruses are encircled with an envelope containing viral nucleocapsid, and these nucleocapsids and copy are arranged in helical symmetry. Okay, so the given options, all of them are true about SARS-CoV-2. And also, if you look into these structural proteins, 4 major structural proteins: spike glycoprotein required for entry of infectious virion particle. Membrane protein is the most abundant viral protein. Envelope glycoprotein, smallest among major structural proteins, and nucleocapsid protein. So I can provide you a reference article if you wish to refer more information. So this is from American Society of Microbiology official website, and they have an article regarding the structure of coronavirus, the microbiological aspects of SARS-CoV-2. You can refer that link, cmr.asm.org for more information. Okay, so fantastic. Right. Now let's conclude this session with this case-based question related to hypersensitivity, which is apt for general path as well as micro. So what do you think more appropriate answer is? A patient develops type 1 hypersensitivity allergic reaction to latex. So when treating him next time onwards, you can, option A, wear hypoallergic latex gloves. Option B, don't wear gloves because you have a reason for that. Or option C, wear vinyl gloves. Option D, very unfortunate, but don't treat the patient. So which one would you choose? Which of the following options would you choose? We'll discuss this in tomorrow's live session. And in the meantime, you can find out what the more appropriate answer is. So can we go for hypoallergic latex gloves? Because it is hypoallergic. So do some homework and try to find out. We'll review this in tomorrow's session. Okay? Well done, everyone. So let's conclude our quick revision class and let's move on. So I really hope, I sincerely hope these sessions are useful. And as I said, if you have an orientation that even if even if you learn 1 point from this entire session, consider the objective to be fulfilled. Consider the objective of attending these sessions fulfilled. Because what if this 1 point comes in exam, right? So this will ensure that you are participating in any kind of discussion or in learning process as such actively. And it's always good to have doubts, and if you have any doubts, you can always get back through mail for doubt clarification using a doubt clarification form, an active way or active approach to get all your doubts cleared in a proper way, in a standardized way, right? So once again, I really appreciate all your active participation, and just keep this consistency, enthusiasm, and momentum going. It's just another 1 week time, around 1 week time. It's going to be amazing. Just believe in yourself and give your best each and every moment. And I started this session by saying that it's quite natural to feel low, to feel demotivated, but that's all part and parcel of one's preparation. So by now you should be familiar with overcoming those negativities. So all you need to do is just take a break, relax, revisit your strategies, and no matter what you do, as I mentioned prior, confidence building measures have to be undertaken. That's what really matters, especially in these final days. So whether you revise your notes, practice MCQs, take up tests, it's completely your choice, right? So do things which enhance your confidence. That's all I would recommend. So I'll see you again tomorrow in another quick revision class. So take care. Love you all. Raghavendra, if you hope that only these come in exam, that would be cheating. I never say, I never guarantee my students saying that in this live class you'll get these questions. I mean, that would mount to cheating. I mean, then what's point in preparing? Then we can do one thing. We can just conduct these classes, and you need not prepare for anything else, right? No, never hope for such things to happen. The paper has to be challenging, and just hope that you'll be able to answer it. So believe in yourself and give your best. And if you want repetitions, you practice some MCQs or you attended some discussions and you want those questions to be repeated in exam, I don't think that really serves the purpose of giving the entrance. Because as you all know, by now, the objective of preparing for entrance is to expand our knowledge base so that we are laying a stronger foundation at this undergraduate level, at your undergraduate level, so that it helps you progress accordingly, not just in your post-graduation, but in the rest of your professional career, clinical practice, including academics. So don't just hope for questions to be repeated. Let there be new questions, let there be challenging questions, let there be case-based questions, and just pray or hope that you'll be answering them confidently. Just believe in yourself, right? So have faith in preparation, in your preparation. So definitely all good things will happen. to those who believe in themselves without any doubt, right? In fact, it's a selling point for me if I say that, in fact, there were, of course, we'll be discussing thousands of points in the process of this 1 year preparation coaching. And obviously, some points or some questions will be repeated. It doesn't mean that my coaching is superior. No, there shall be no such correlation. All that really matters is how you're enjoying your preparation. Are you enjoying and participating in these sessions? Are you learning something from these sessions or from these discussions? That's what ultimately matters. Because the reason I'm stressing on this is I have students asking me, like, we follow a particular book or particular guide or particular test series. Will we get same questions? Or our friends say that we get most of the questions from a particular source. I mean, that's utter foolishness. If questions are being repeated in final exam, then what's the point in preparing? What's the point in referring standard literature? What's the point in learning? Just mug up some books or practice some MCQs and vomit on the day of exam. That shall not be the objective of preparation as such. So it's all about expanding our knowledge base, trying to understand concepts, and finally, at the end of the day, it's about application, case-based in our personal experience or in our personal clinical practice or in our academics, because ultimately all this reflects on to how we serve society. So if we want that to happen in a good way, then we have to learn in a good way, isn't it? So this I'm telling for everyone, not to a specific person, right? I really hope you can understand the intent behind this and just keep your spirits high and keep this momentum going. Love you all. Take care. Good night.